Welcome back, everybody. Everyday Health Hacker, Dr. Lisa Leal. And today we're going to be talking about happiness and a toxic migraine. Don't let a toxic migraine steal your joy. We are going to share today some of the things that you can do immediately to feel better, have wellness, and an improved outlook on life by curing those migraine headaches. So many to talk about, and we look forward to today's episode with Mike Hertzing.
Welcome, everybody, to another edition of Everyday Health Hacker. I'm Mike Herzing, along with the famous Dr. Lisa Leal.
Hello, everybody. Welcome to be back in Sugar Land, Texas. And today we have some really great hot topics.
We do. Dr. Leal is Chief Medical Officer right here at Meridian Health Institute in Sugar Land, Texas, like we said. And everybody wants to be in Sugar Land except for maybe this summer because it's really hot. Well,
yes, it is.
In response to a lot of emails we've been getting from patients and listeners and just friends, we're going to talk about toxic migraines. Now, yes. I just asked you off the air, we're going, what's the difference between, I thought all migraines were toxic because they're just horrible.
So what I define as a toxic migraine is that migraine that prevents you from being able to work. Maybe you're not being able to maintain employment because the migraines are always there coming back. So you're calling in and not able to sustain a job. Number two, that headache is so bad that you feel like you have to go to the emergency room, or you end up in the emergency room. And I have to say, recently in treating some patients, we had a case that it truly broke our entire team's heart because the person did all the right things. They went to the emergency room. This is a new patient for us. They started an IV, and this is a big guy who was not in tears, but you could tell that the pain was so bad. If he was a girl, he would have been in tears. Yeah. And he had bruises all along his arm because the ER was just kind of tough with him. And it's so unnecessary because he had great veins that we could easily. So we immediately all went into action. We started an IV. We gave him some medications. And when I talk about a toxic migraine, this is a medication that you've taken a tablet. Maybe you've taken Excedrin migraine over the counter and it didn't work. You've taken, and I'm going to name several different types of medications that are out there: rizatriptan, sumatriptan, Zomig, Nurtec. All of these different dissolvable medications. Some are tablets, some are nose sprays, and we use them for different scenarios for a migraine headache. And people who have chronic migraine, what we call chronic migraineurs, that is a person that's having more than 5 headaches in a month. Now, because we specialize in headaches being medical dental, we look at it not only from the perspective of medications, we look at what is the root cause. Mm-hmm. And many times the root cause is because somebody has an underbite, overbite, a crossbite, something that's very simple. Maybe they're missing a tooth, and as they try to balance the teeth when we sleep at night, we're trying to balance our teeth, but with this anxiety and devastation with COVID, the economy, looking at the news, people are grinding and clenching and overly anxious, which makes people who have migraines more susceptible to a toxic migraine. So with that individual, what we did was start an IV. We gave IV medication. We helped calm the nausea with medication, and within 45 minutes could turn this around to where he's like, oh my gosh, my pain went from on a 1 to 10 scale, a 12 is now a 3, and I just feel this dullness, which was really nice to have him have some relief and say, oh my goodness, I have an option here of being out of pain. No one's gotten me out of pain. And I'm going to share another little pet peeve with the ER that I found.
Oh, no.
Because as I'm reviewing this person's medications that they gave him at the ER, they gave him amitriptyline. And amitriptyline is great for chronic pain. It really does work. However, we start at 10 and 25 milligrams. They immediately started him at 250 milligrams a day. And that in itself will cause headaches. So, I got my mama bear hat out and had a nice discussion with the ER on patient planning and treatment planning. And if you're a doctor out there and you're wondering what that is, or you've had a phone call, it is not a tear down, you did this wrong. It is about what can we do better. We're a community of healthcare professionals. We have to support each other and what we can do better. And I truly believe that we are better together, and everyone is on overwhelm. This morning, we've already had 9 COVID calls, and we're only on a half day So I expect more to come through. We're in this together, guys. But with toxic migraines, I want you to know sometimes you're going to need an IV. You're going to need hydration, medication to stop the nausea so you can keep the medication down. And you're going to need what we call medication that is on a daily basis while we determine the root cause. And that root cause may be dentistry, maybe medicine, maybe a combination. And that's actually why Meridian Medical Dental Meridian Health Institute exists, is because we're here to take care of the whole person.
Okay, I've got a question.
Go for it.
Let's say, like you said, he took all these different medicines.
Yes.
All right, but you've got a regular person here, and he takes this medicine, and it
Yes.
doesn't work.
Yes.
And he waits an hour, and he goes, I'm dying, okay? I'm going to take this medicine.
Sure.
And then this medicine. And he's like,
They're in
what can I
overlap.
do? I've got 3 of these things in my system. I can't just flush them out and then start over with another. Sometimes, doesn't that cause another problem?
Correct. And that's one of the things that I always share with patients is that, if you're not clear, you have the opportunity to email us, text us, call us. And I truly mean that day or night.
But not everybody has you. That's the
However,
problem.
everybody has the option of having, and as I always share, talk with your primary care physician, your headache doctor, your dentist, and have a treatment plan. What does that mean? So I have for patients, I say on a 1 to 10, where are you? At a 4.5 on that 1 to 10, you need to start taking action. Number 1, are you wearing your splint? I'm taking my splint out. I'm showing everybody on my YouTube family. This is what a splint looks like. Putting that in. And what that actually is called is an orthognathic.
It's easy for you to say.
An orthognathic splint. Now, that's a long term. We call it splint therapy in the office to keep it easy. But what that means is that, like, my jaw is jaw on jaw because of my rheumatoid arthritis. So by preventing my jaw on jaw, which that is 2 bones rubbing together, by wearing this splint, I get a 2 to 4 millimeter, depending on which size that I wear, that helps to elevate the condyle so that I'm not rubbing, so it's preventing me from having the headaches. Other people, if they have a crossbite, it never fit into the socket, and that's genetically the way they were born, but we can actually move that into the correct position. Number 3, so that first question is, are they wearing a splint? Number 2, did they need to take something? Tylenol, Advil, Excedrin, migraine. And again, I'm not a person who is going to say, go take all this medication, because we can also use something, if we want to go from a natural realm, is, do you have some oxygen boost? You can buy that on Amazon.
Right.
And we carry, obviously, as a medical facility, we have oxygen here. We'll put oxygen on the patient because that alone can sometimes relieve their headache. I have oxygen boost because, it's hot out here. I mean, we're at 112, 115 degrees. You can get short of breath pretty easily.
I got some the other day. You guys talked about it.
So it's hydrating. So those are 3 things that we can all do on our own. Wear a splint, have oxygen, get hydrated. If that is still not working, you might have a migraine medication. Some of them, like I shared, is a nasal spray. So people who are nauseous should probably have a nasal spray. If they're nauseous, it needs to be a dissolvable type of medication. There's several that are provided that are like that. And then there's some that are injectable. And those are also, but they're different levels. So that's stage 1. Stage 2 is the medication. Stage 3 is the injectable. Stage 4 is us, the doctors, and the emergency room. And we want to try and prevent that. However, if it's occurring in a regular basis, we have something that's called prophylactic therapy, which means you wear a splint, you have a medication that you take on a daily basis so that it helps the nerves not send the communication to the brain to trigger the headache. I know that's a lot.
Yes.
I know that's
It
a lot.
is.
And it's very important that everybody understands that there's stages of a headache.
Okay, I want to say something.
Uh-huh.
When people call your doctors, you call the number and it says, "Hi, welcome to so and so."
Yes.
Please listen to the menu because it may have changed. Everybody says that, and then
Yes.
you want to strangle
That
them.
gives you a headache
Then
in
it says,
itself.
and if you have an emergency, dial 911.
Yes.
They always say that. And then it's like, if you're a doctor or physician, dial 1. All that stuff. And then it says, if you have you need to talk to the doctor, leave a message and the nurse will call you back.
Correct.
Usually at the end of the day
Correct.
before they leave.
And now,
And that's the problem. You guys will call us back right then, or you answer the phone.
yes, we are, as there's corporate
That's the
business.
difference.
We are a corporation, but we're a small business. And it's very important that we have your call answered. And people do call us from out of town, out of state, and we can help guide them as to what they need to ask. Sometimes we are using the Learning Lab at everydayhealthhacker.com
Sure.
as a way to look at videos on the subject matter that you're thinking about so that you can have a conversation with your doctor. Because we want you to find that primary care physician that's in your area that's going to listen to you. So many people are misdiagnosed because they are not allowed to give their full story. And that's where I always share, before I send a referral to another doctor, I write your story and I send it. So sometimes as a patient, I encourage you, write your story, email it prior so that the doctor can have, or nurse practitioner can have an idea of what's going on, and then we can ask you questions. That's why it's important for a history and physical to occur. However, if you're only spending 3 minutes with a doctor, they're not going to find the root. And this is about taking the time, 10 minutes, 20 minutes, 30 minutes, 40 minutes. Sometimes a consultation between the team is 2 hours, and that is 10 of our healthcare professionals going in and out to find out and find the root cause so that we can get you on the right plan.
Right. What I'm saying is, if they don't do what these people do here, find a doctor that will.
Exactly. And
That's
they're
what I'm
out
saying.
there. And, one of the things that
They're
I
out
encourage, if you are a doctor listening and you have that like-minded practice, please email me, call me, text me. I would love to add your name to our website so that we can refer patients that are in your area to you.
info@everydayhealthhacker.com.
Absolutely.
That's pretty simple.
Absolutely. And any more questions, comments, we hope that you'll subscribe on your favorite platform today, because we are here to help you, your family, your loved ones, and we look forward to you getting in contact with us.
Absolutely. On behalf of all the folks here at the Meridian Health Institute and Dr. Leal and myself, thanks for listening and joining in. And we please say something, comment. Always info@everydayhealthhacker.com. Have a great week.
Have a great week. God bless. And remember, there's also Psalm 911. And sometimes it's really great to read that. God bless. Talk to you soon.